We are Jan Silva, a spine surgeon from Brazil.
My name is Raj Mishkov, neurosurgery resident from Denmark.
I'm Sonali Das, orthopedic resident from India.
So in this interview, we are honored to be joined by Professor Mazda Farshad, a world-renowned leader in minimally invasive spinal surgery and endoscopic spine surgery.
He is professor and the chair of orthopedic surgery and the youngest chief medical officer at the University of Zurich in history.
Dr. Farshad is an enthusiastic of our endoscopic spine surgery, received several awards. He's the founder and main manager of Surgeon, a project of the University Medicine Zurich, with the aim of developing disruptive surgical techniques for more precise surgical results using augmented reality. So let's start our interview. Before beginning, could you tell us your full name, specialty, and full current position?
Sure. Thank you very much, everybody. Nice to be here. Thank you for the interview. So my name is Mazda Farshad. I'm the chair and head of the orthopedics and spine, and the medical director of the Belgrade University Hospital, which is the largest orthopedic hospital in Switzerland on the university basis, so the largest university hospital for orthopedics. And I'm happy that I'm here with you.
So could you share a bit about your roots, where you grew up, and how this influenced you as a surgeon?
Yes, sure. So I was born in Shiraz in Iran, and then we went to United States, Canada, and then finally to Switzerland. So I was a child when we came to Switzerland. I grew up in Zurich, Switzerland. I did my school and also my college and medical school in Zurich. And did also the surgical residencies here in Zurich, but also in United States, and specialized after the orthopedics and traumatology board into spine surgery with several fellowships in Zurich, but also at the Hospital for Special Surgery in New York, where I was a chief spine fellow. I then came back to first to Geneva and to the University Hospital in Geneva, and then took over the position as a chief of spine in 2014 in Zurich, and in 2017 I took over the position of the chair and professor of orthopedics and spine in Zurich, which is also simultaneously the medical director of the Belgrade University Hospital.
Great, thank you very much for your answer. I think you also answered the part with the training and where did you complete your residency quite nicely. So I think we'll go to Sonali's next question.
Right. So I would like to know, why did you choose this field? What do you think are the pros and cons of becoming a spine surgeon?
Well, I believe that spine surgery is the most interesting surgery after having looked into several surgeries, but it's the unique combination of biomechanical understanding and neurological understanding. And the spine surgery is very interesting because you can have a huge impact on a patient's ability to function, basically. So on a human ability to function. So on a surgical and technical level, that's why I think spine surgery is extremely interesting. But also because in spine surgery, there is still a lot of room of improvement. If you look at the current state of the art in spine surgery, being it the identification of indications, the debates on indications, the debates on the techniques, the possibilities that are around, the management of complications, and so on. So spine surgery, there is a lot of room to still change the way spine surgery is done, and that's the most interesting part of spine surgery, to my opinion.
So, great. So, thinking about your professional journey, who inspired you the most to become the surgeon you are now, and why?
Well, you know, I would not name a certain person or so. You know, it's a whole journey, right? So the question goes back to why did I do medicine and why did I do surgery and so on, and um, it goes back to, you know, even historical figures in medicine, like Avicenna, thousands of years ago, who are very inspiring for me already as a child, to get into the field of medicine. And one of the largest inspiration was, again, which is, you know, um, the work that I want to do, which I can consider not just as a work, but more than a work, really, a purpose in life. And I identified medicine as such. And with this, then the field of surgery became evident, because in surgery, um, the impact that you have as a surgeon on patients is extremely direct, right? And within the surgery, again, I mentioned before why I think spine surgery is extremely interesting. And of course, during my path of you know, medical school, medicine, orthopedics, spine surgery, there have been several giants that I looked up to and inspired me. Certainly, like we all do. Those who inspired me intensively, that with direct impact, and those figures that, you know, have basically changed medicine and surgery and spine surgery, who even do not live anymore, but just by their story and their way they have done things. I'm thinking of the, you know, of the founders of aspects of spine surgery. Those are inspirations for us all, right?
Well, taking into account that you have worked in different settings, do you think that the health system features, such as the public versus private or other examples, could influence the work for spine surgeons?
Well, optimally not, but it does, right? Um, Optimally, a physician and the decision of his physician would not be influenced by the setting in which he is, but certainly it does, right? It's a question of what kind of possibilities do you have to treat a certain situation. For example, take a condition of any kind, scoliosis surgery, for example, right? Depending on which possibilities you have, in which country you are, and what the healthcare provides you, you will do scoliosis surgery differently, or let's say a little bit differently, right? And then comes the whole topic of what kind of education did you have, what kind of network, scientific and clinical network do you have? So the answer is yes, there is a difference in the way you do surgery based on the setting that you're in, and this also affects public versus private institutions, certainly.
Every professional has that one memorable case. Could you share a bit about yours and the lessons you learned from such a case?
I believe it's just, I mean, when you have done around 6,000 surgeries, it's more than one case, right? That is memorable. But let's say, if you want to point out one case, there are certain cases, of course. I mean, um, Actually, one of the cases that could be an example is once I think that was back in 2012 or so, or even before that. Once I had a small child, 4 years, a girl, who had a motor vehicle accident and had a very weird, basically pull out of the dents from C2 with angulation through the growing plate of dens and the arcus, right? Um, so not really described otherwise, and finally we described it as a case report. But so the question there was how to treat this patient, and that was a case that I was fully responsible for because I was on call, and there was really nobody who could help me in this decision, and the decision needed to be fast. So what I did basically was I decided against surgery, and I did a reposition of the dents through the mouth of the patient in sedation, and put a Minerva gips. And there was nobody helping with the Minerva gips, so I needed to do the Minerva gips basically by my own. And why I'm telling that is, other than it's a memorable case just by pathology or the pathomorphology, it was a situation where I had to take responsibility for the life of a 4-year-old girl who just had an accident. The full responsibility, right? And that's a very, very special feeling. And that was one of the let's say, memorable cases where it was very clear that, to be a good surgeon, even if you don't do surgery, you have to take responsibility and ownership for the problem that you have, and that's a patient's condition. And there are several cases like that, right? Actually, every case is memorable, although some cases, of course, are, standard, but even those can get memorable very soon if you don't, if you're not careful.
You're currently a faculty member of AO Spine, and it's important for a spine surgeon to be part of an academic community like AO Spine. In which way AO Spine influenced your career?
Well, so I was a AO Spine fellow in 2013, and the AO Spine is just a wonderful community which allows connection over countries, and this is eye-opening. So if you have the possibility through a network to talk to specialists in your field in other settings, then this is unique, right? And this is extremely important. So also to ask yourself, are you doing the right things? What are people doing on the other side of the world? What is a consensus for a debatable topic? So I think networks such as AOSPAN are extremely important for just trying to harmonize the best care that we can give to patients worldwide, and to share information, to share experiences.
Thank you. And you are a worldwide recognized research and educational leader in spine surgery. To what extent do you think it is important for a spine surgeon to also do research and teaching?
So extremely important, because the thing with research and teaching is this. If you want to, let's start first with teaching. If you want to teach somebody something, you have to first understand it, right? So teaching correctly a content to someone means that you have to take care of that topic that you're teaching. You have to know what you're talking about, and this forces you to basically, you know, getting fully involved into that topic, which brings your knowledge to a different level. And then teaching also means that you have not only to understand it so that you can basically use that information, but you have to have even a deeper understanding so that you can teach this information. So if you look in the, in the research of learning curve research, then mastery is a master surgeon is a surgeon that can teach in a very good way the content, right? So the highest level of mastering a certain task is to be able to teach it in a good way. So that's teaching, and research goes in the same direction. If you want to bring further a certain specialty or an area, you cannot do research on old stuff, right? So you have to know what has been done already. So you have to update yourself by the information that is around worldwide to be able to make the next step. This means that you have to be at the forefront of know-how about the topic that you're doing research on. Otherwise, your research will not be valuable. So both research and teaching are extremely important to make a spine surgeon really a brilliant spine surgeon, I believe.
Coming back to your career, what is the achievement you are most proud of?
Oh, that's a difficult question. I'm I'm not sure if I have achieved enough to be proud of, to be honest. I maybe there will be an achievement that I can be proud of in future. We've done a lot of things. I've done around 300 publications, right? Peer-reviewed publications, a lot of research, a lot of surgeries. I think one of the maybe things that could be mentioned is that with a great team that I have, I'm blessed with a great team. We've been able to create platforms basically where teaching and research can be done in a very, very good and efficient way, such as, let's say, ORX, which is a research infrastructure that we built for surgical innovation, or the cooperations that we did, Surgeon and so on, bringing people together to go further, right? Because I think only together you can go really far with multiple disciplines. Creating new surgical techniques and so on and so on, creating new know-how. These are things that finally you can be proud of, I guess. Yeah, but I'm not sure if a surgeon should really be proud of anything. It's the same thing, like, is the learning curve closed at any time? I don't think so. I really believe that if a surgeon thinks that he has nothing more to learn, that's the second he should stop doing surgery immediately, because then it becomes dangerous, right? So proud goes in the same direction. I don't like this question.
Nice. We're gonna check on that. So, in this sense, if you could turn back time, what advice would you give to your younger self? What would you have done differently?
Oh, probably trust more on your instincts in different situations. When I'm looking back, there have been situations where, my instinct told me to go in a certain direction, and then by writing down everything and trying to do it in a logical way, maybe I went in another direction. And looking back, probably the instinct would have been as precise, if not more precise. So trusting your inner gut in certain situation is probably a good advice, because it combines your experience, your know-how, and certain things that you maybe cannot even measure. I mean, there is this concept of so-called rapid cognition. So it's not really an intuition, it's a rapid cognition that happens, which we call instinct. So I think this is the advice that I would give to my younger self.
Very insightful. Thank you. How did your journey in endoscopic spine surgery start?
Well, it was by a need, right? The need was that how can you in certain situation avoid larger surgeries, be more minimally invasive, even avoid spinal fusion surgeries in certain situation. I mean, I do a lot of spine fusion surgeries, but they are all sometimes associated with problems, right? On the long run. So being less invasive can be an advantage to your patients, for your patients. And this is how I started to look into this philosophy. And basically, we started endoscopy a decade ago, but then we stopped it a little bit because the technology was maybe not far enough. Especially the education on endoscopy was not there, and so on, not systematically, not structured. And actually AO helped a lot in that, because I remember back there was an AO course that I even visited, to take a look at that, and that was in my function as chief of of spine. And as I said, the learning curve never ends. And this is how it all began, and then rapidly we implemented that, and we thought that we have to implement that more and more. This is why we took that topic as a really academic center, and implemented it not only clinically but also in research.
What do you recommend to surgeons who want to start endoscopic spine surgery?
Well, the journey with endoscopic spine surgery is a special one. I believe that endoscopic spine surgery should be done by spinal surgeons who are already quite solid spine surgeons, because understanding of the anatomy in spinal endoscopy requires an overall understanding of anatomy and pathoanatomy of the spine. So it's much, much, much easier and safer if you have done all the procedures that you plan to do with endoscopic spine surgery already in a, let's say, traditional way, and not only having done that, but mastering it. Because that allows you to have a much faster and safer learning curve in endoscopic spine surgery. And This is one advice. So be comfortable with spine surgery for the indications that you use endoscopic spine surgery. Because also there might be a situation that you are doing an endoscopic spine surgery and 1-2 hours have passed and then you do a durotomy and you have cut off fibers and so on, and then you have to immediately be able to convert and solve the situation, right? Um, and if you lack expertise in that, that will be your last endoscopic spine surgery. So be very comfortable in the indications you plan to do with spinal endoscopy. I would certainly not start right away. There must be this must be accompanied by a clear training structure. So basically, actually, we have built up a whole academy for that. It's called Endospan Academy, where we took all 9 world leaders in spinal endoscopy, put them together, and founded an academy to promote basically the learning of this technique. So I really believe that the structured training and endoscopic spine surgery is extremely important. So how to start the journey with endoscopy? First, you know what you're doing with classic techniques. Second, be able to treat your complications if they happen. Third, get experience on simulators and cadavers in workshops. Fourth, be sure that your first cases that you're doing are supervised by someone who is an endoscopic spine surgeon. And fifth, don't know your limits. Know your limits. Don't start with hard cases, of course. Choose the right cases in the beginning. And we have actually created a whole classification system on complexity of spinal procedures for endoscopy and complexity of pathoanatomy for endoscopy, and then like a scheme where you can assess where am I in this area, in the red area or in the green area and so on. It is not yet published, but it will be soon published. So these are the advices.
Very nice. So to end, let's engage in a game in which we ask you a question and you reply with a quick answer. So, what's your hobby?
Other than surgery, sports.
What about favorite book?
Mm, hmm. I've read so many books. Oh my goodness, you're asking questions. You know what? What influenced me a lot is Miller's Orthopedics, to be honest. That's a great book.
What's your favorite sport and team?
Favorite sport right now is golf, and that's a single player thing.
Okay, so favorite surgery?
Oh, well, oh, I love all surgeries, but anterior scoliosis surgery, anterior correction for scoliosis is a very nice surgery, very valuable. Um, Posterior endoscopic cervical decompression uniportal for myelopathy or foraminal stenosis to avoid ACDF. Over the top, uniportal over the top endoscopy interlaminar for treatment of contralateral foraminal stenosis. Very nice to avoid, for example, fusion surgery in L5S1 foraminal stenosis situations. So these are elegant surgeries, or even selected X lifts, L lifts for scoliotic deformity. Name it. All of the surgeries are great.
What should it be, navigation or freehand?
Freehand.
Do you prefer tubular MIS or endoscopic surgery?
Endoscopic. You
A
know why?
word? Oh, sorry.
Because of the in endoscopic surgery you have continuous irrigation, and the visualization is amazing, and the infection rate is quite low in endoscopic spine surgery. So these are really advantages of it.
And a word that defines spine surgery?
Oh, the right indication. It starts before surgery.
Very nice. So thank you so much for joining us today and for being a source of inspiration and motivation for young spine surgeons from your Spine Youth Club. It has been a true privilege.
The privilege was mine also. All the best for your curriculum and careers in spine surgery.
Thank you.
Very nice.
Thank you very much.
Thank you, Dr. Farshad.